PHAMCAST in this special episode of Heart Health on PHAMCAST. We've had two great conversations with Dr. Vineeta, who's here, and now we get to welcome someone else to the table that you're all familiar with, because not only has she been on the podcast before, she's a PHAMbassador, a dear friend, and somebody who really saved me and my hormonal health. Dr. Kristy Prouse is in the house, and it's so good to have you back. Dr. Prouse is the Chief Medical Officer of Regenilife, as well as the founder of the Institute for Hormonal Health and Functional Medicine trained, as well as an OBGYN. Can't think of anybody better to talk about hormonal health and the role it plays in heart health than you. So welcome. And having you both here working better together and talking about this conversation from a real collaborative and integrative and patient-centered lens just fuels my heart. So welcome.
Thank you. Excited always to have a good conversation.
Yes, yes. So we can't, hormonal health, and you'll be the first one to sing this from the rooftops, impacts everything. And certainly hormonal health and heart health go hand in hand. Men and women can be different, but their hormones still impact heart health. Can you speak to that, Dr. Prouse, about sort of the role that hormones play?
Yeah, for sure. You know, if we look at the hormone that is common to both men and women, is cortisol. Yes. Cortisol is a stress hormone meant to help us manage with our stress, and of course, the system can be on overload, and that cortisol dysregulation can lead to insulin resistance, adiposity, and the central obesity that can cause inflammation, which is linked to cardiometabolic disease as well. So that's one big hormone. But to boot, women in particular also really get double whammy when they go through menopause, which is really a cardiometabolic inflection point for women, and things really start to shift for them. In fact, the risk of cardiovascular disease increases by 3 to 4 times in that.
Is it that much?
Yes.
Yeah.
Wow. And that is really largely because of the impact that estrogen has from a cardiac standpoint. Estrogen in its more youthful state is very cardioprotective, but when it drops with menopause, things really start to shift, where we get into things like endothelial dysfunction, which is the cells that line the cardiac vessels, inflammation in the body, the insulin resistance piece of it. We lose the elasticity in our vessels. Our cholesterol starts to shift in a negative way. So lots of impact from the dropping estrogen levels for sure. Men, on the other hand, testosterone plays a very similar role. Testosterone, whether it's too low, puts you at cardiovascular risk, whether it's too high. The body wants to have hormones within the physiologic range. And when they are in that physiologic range, they tend to be protective.
So thank you for that explanation, because there's so much confusion out there, and I think it's really important. When we can't see something, we don't understand what it's physiologically doing in the body. And but when it starts to manifest as symptoms, then people take notice. And I think this is a really good jumping point to talk about exactly that. How do men and women present differently in cardiovascular health? I don't know if you want to start first with, in terms of, from a cardiology's perspective, what are the differences with the way it's going to manifest and what people can expect to feel or not feel?
Just coming back to that incidence for a minute, how it increases at menopause, it's actually, the incidence in women is less than half of that of a man prior to menopause, and then equals that of a man at menopause. And then after age 70, it far surpasses what is happening with men. So this whole low estrogen phenomenon is really scary, as we go forward. So now we have interventions.
Oh, which we're going to talk
right,
about.
Yes.
Oh, we got to talk about that, yeah.
But the difference between men and women is huge in how we present with cardiovascular disease. And some of the reason is that we develop coronary disease in slightly different ways. Rather than getting the huge, rapid obstructions of one artery, we get microvascular disease. So small branch inflammation, small branch stuttering sort of angina that happens over a period of time. So the symptoms are not that Hollywood crushing chest pain, dropping to the floor. They're more staggered, if you will, and they can be different. It can involve nausea, indigestion, a sensation of heartburn, sometimes a jaw ache. You go to the dentist and you say, my jaw's hurting, but there's nothing wrong with the teeth. So sometimes it's triggered by a dentist saying, well, that jaw pain might be something else. And often women don't seek the help until they have that jaw pain. All the other symptoms are just ignored. Or they go to the ER and it's deemed panic attack or anxiety or hysteria, and they end up doubting themselves, doubting their instinct, not trusting their body, and saying, okay, yeah, maybe they're right, maybe the professionals are right, maybe it's nothing.
You're so right, because I've been with family members where that has been the case in women, and you just need to calm down. You just need to take it easy. When
and
in
it's
fact,
not until we check the troponin level, someone will say, wait, this is the second time she's in the ER. Let's just check a troponin level. Troponin levels are high.
now that's for everybody. I certainly know what that is. Let everybody at home know what is troponin.
So cardiac biomarkers are something we can check in the bloodstream during an acute heart attack, where the heart is releasing sort of these distress signals into the bloodstream. It's kind of like broken down protein that enters the bloodstream, and you can check that in the blood. If it's elevated, it means that there's a distress signal, something's going on.
Right, amazing. So you made mention of the fact, so we find these symptoms, and men can present differently as well with, like, it's not always grabbing your chest, right? I, as a therapist, I've had people with back pain on my table that's gnawing and ongoing, but when I palpate, I'm thinking there's nothing wrong with the soft tissue here, and that's my signal as a massage therapist. Wait a minute here. If nothing's resolving, maybe you should get to see your doctor. What's your blood pressure like, which we can take? All of those things. So I think it's really important to distinguish also that men don't always present, like you said, in Hollywood movies, where they're grabbing their chest and dropping to the floor, correct?
Yeah, absolutely.
Yeah. And I think actually, one of the things that's important too is we often refer to women as having atypical presentation.
Yes.
But the reality is that the reference point is male.
Yes,
right.
It's typical for them.
That's right.
Yes. Yeah.
Right, but we know that 50% of women actually,
That's true.
present otherwise. So
Such
it's
a
not
good
really atypical. It's sure atypical with male as the reference.
And you know what, this is such a good point, and such another whole show and conversation, talking about, in healthcare, a big issue we all know, and there's a light being shone on it, that research isn't focused in women's health, and the markers aren't necessarily for women in particular. So that's such a good point. Thanks for raising that, Dr. Prouse. So you mentioned about, that we have symptoms, and then what can we do? Because this is about empowerment. And so one of the things from a hormonal perspective, and I say this so many times, saved me when I went through menopause at 39 and was having horrible symptoms, and this was many years ago, and long before this menopause movement was being talked about so much. And you really helped me, and I've been on bioidentical hormones, which has made a massive difference in not only the way I feel, but I'm hoping and also protecting me from things like cardiovascular disease, dementia, and other things. Can you speak to the role that hormone replacement can play, and that not all hormone replacement is created equal?
Exactly, and you made reference to bioidentical hormone, which just basically means a hormone that matches what our body is producing. And so therefore it behaves in the same way, and our body knows how to break it down. And I think that is a very important distinction. Because there is that change in cardiovascular risk with menopause, and that increased risk really happens the first 5 to 10 years, it's one of the reasons why it's important, if you are going to start on hormone replacement therapy, to do so within that first 10 years, because you're trying to shift those profiles, whether it be cholesterol or the inflammation or endothelial dysfunction that's happening. You want to get on top of that sooner rather than later. Exactly. And so there is some magic, starting on the first 10 years. There's differing evidence beyond that, but there is some value on getting
now
sooner.
there's a lot of fear. That doesn't mean that women can't ever be on some form of hormone replacement, whether it be, it has to be seen by somebody like you and knows what they're doing and be tested. But I know there's a lot of people, my doctor said I can't do that because it's been past the 10 years. Am I correct in saying, depending on the person?
Absolutely. This is where we get into precision medicine.
Correct.
And one, what fits for one doesn't necessarily fit for another. And, in conventional medicine to date, it has largely been focused on averages and applying it to the average person, where who's to say, I know you're going to be different than me. That's right.
Yeah, it's true.
Right, so, we really do have to individualize, and what are your goals and expectations, and if there are risks there, what risks are you willing to take? And
So when we talk about precision medicine, one of the things we need the most, and what's so exciting at this time we're living in, is precision diagnostics, and really looking deeper with AI to really see a different picture so we can make customized, personalized plans. Can you speak to that, both of you, about the importance of this kind of diagnostics and how it's changing the way you both work?
Well, for sure. And I think we're actually living in very exciting times, and medicine is changing very quickly, and everything from the biomarkers that you made reference to earlier, like really important that women have access to their lipoprotein A, ApoB, their HSCRP, which is an inflammatory marker, or their fasting insulin, to get a whole picture and blood work, and yet the imaging is where I find it particularly exciting and where things are changing. And I think what I'm about to say is particularly important for women.
Yes.
And we can go into that, but basically now, and there's one thing when you're having an event, and a myocardial infarction, that's, you know, you would go one route, but if you're looking at the preventative angle and trying to make a difference before it becomes an actual problem,
Yes.
That's where we're starting to get into CT angios overlaid with AI that are really making a huge difference, because we can really non-invasively basically map out the entire cardiac structures and can distinguish at a level so much so that we can see now the difference between a hard plaque and a soft plaque, which has different risk factors. For women, their plaquing in their heart often is more of an erosion versus a rupture, so you can, you know, pick up on very, very subtle disease and stratify risk and treatment.
And yeah, get them into action with a treatment plan that's going to be specific to them to get better outcomes. That is it's so exciting to be able to do that.
It is. To Kristy's point, that's where you really see the gender difference on the scan. You see how women's hearts behave so differently than men's.
Yeah, yeah. And so with, you know, this type of testing and with hormones, I'd like you both to weigh in, you know, as a gynecologist in functional medicine, and you also trained that way as a cardiologist. How do you two see the future, or the importance of collaborative and integrative health, both from the patient outcome perspective, but also from the learning that we can do from one another?
That too is a very exciting time, because I think we're really starting to see things shift. You know, both of us are conventionally trained, and yet we both have training beyond that in areas that I think really only benefit our patients to that degree more. But the rightly or wrongly, the conventional training allows us to speak to other physicians and gives that credibility to other work that we're doing as well. So I think that's just bringing more and more people into, you know, I hope it's a tsunami.
Yeah.
Yes.
I think we're at the very beginning.
Yes.
And it just needs to be that tipping point where it flowers, you know, and we start to really see things more clearly.
And I couldn't agree more, which is why I think PHAM, Preventative Health Movement, in just 3 short years is literally, you know, be careful what you start, because it's taking over. It's struck a chord with everyday people, but also with professionals alike, because people are burnt out. Healthcare is strained. Well, not just strained, it's crushed. And people are living longer but not living well, and they want a solution. And what I love about this, and I want to thank you both, you know, and I mean this wholeheartedly, you know, to be a massage therapist with a background in kinesiology sitting next to a gynecologist who's functional medicine trained and a cardiologist who's got Ayurveda. And it's, to me, this is what it should be. And we can learn and grow from one another and refer back and forth, and the outcomes are going to be so much better. But it's taken a long time to get here, but I agree with you. You know, I'm humbled when I get referrals from both of you, because I do. And I know that others can do that too, but it's having these conversations candidly, based in science, and being, you know, we're not here to put down the conventional medical community, because I'm grateful we live in a country where we can get access to care acutely when we need it. But that's really important, and it's really neat to see. Has it been, I mean, I know your story, and I'm going to ask you the same. It takes courage, doesn't it, as a conventionally trained doctor, to sort of go out there and speak. You were one pioneering, and one of the first people to leave the hospital and say you were going to open the Institute for Hormonal Health. What did your colleagues think?
Well,
It's an uphill battle.
yeah, I thought there was a lot of probably a lot of skepticism.
Yes.
And yet the proof is in the pudding. Here I'm 15 years later, and you know, still going
And
strong.
thousands of lives impacted, not just patients, but other practitioners who have learned from your brilliance, have learned from your inspired leadership, because you had the courage to go first. You doing the same with the way you're approaching cardiovascular care, and you know, talking about nutrition and movement and connection, and you know, that's not necessarily commonplace in cardiology, but it needs to be. And but yet I know it takes courage to do that.
Well, part of the reason we're so overburdened in healthcare is because the prevention piece is missing.
Yes.
It's missing in a huge way, and we can't do that until we empower the patients.
Right, right. And both of you just have, I've referred many people to both of you. You more because you've been around longer in my world. You in the last year, and the feedback, it's overwhelming. The same thing is said about both of you, which I find interesting. I don't find interesting, I knew it, but not only are you brilliant physicians, but you actually care about the human. And you listen intently, you meet them where they're at, you validate them, and then you empower them. That takes time, effort, energy that I know your worlds and how strained and busy they are. And I just want to commend you and thank you personally, but also let you know, and I hope you realize this, that the impact that has is far reaching. When I get calls, you guys make me look good, because I get the calls saying, wow, I've never had an appointment like that. Wow, they have such an amazing way of taking difficult concepts and not making them, simplifying them in a way that can land on the ears of somebody that doesn't maybe have that knowledge, but then converting that into action for them to do something so they can prevent and become the CEO of their health. That's the future of healthcare, in my opinion, and that's why I'm doing what I'm doing. And I just want to thank you both for doing that and for leaning in and being here today. I know how busy you both are. This matters. And what you're doing, I just want you to both know that everybody in Allied Health wants this kind of relationship. And thank you for that.
Well, and thank you for all the work that you do in pulling people together as well. You're a powerhouse in this.
Yeah, and bringing the voice to everybody. That's been huge, Marg, all the work you've done.
Well, and we're just getting started. And as I always say, I'm not doing this alone. This preventative health movement, whether it's all the month of February, where the entire month long, we're going to stock your preventative health toolbox. Each week has a different themed week. We are adding, I've got a big meeting this weekend, we're adding different focus days where there's focus on hormonal health, heart health, mental health, addiction. We go on and on and on. Then there's this podcast and TV show that I'm so honored to be able to host and give you. We have a blog that you should subscribe to where there's free education. We even have a directory, which I am unbelievably proud of, that somebody smarter than me, it was my idea, but somebody smarter than me has made it happen. If you're looking for a cardiologist, you can find a cardiologist or a gynecologist or a massage therapist. But there has not been until now an integrative health directory, because I believe we need to break down the silos and have the patient be able to get their integrative healthcare team, with them being the most important member of their health team. We need to help general practitioners, family doctors be able to refer and find. Well, this directory, you can search not only by type of practitioner, but type of condition. Because if you have diabetes or cardiovascular disease or hormonal issues, or maybe you're struggling with depression, there isn't one answer. There isn't one clinician, and there isn't one magic pill to fix you. But if we have community of practitioners working better together, breaking down silos and helping you be the CEO of your health, we can change the legacy of healthcare and switch this whole idea of lifespan to health span. And that's what this FAM directory is going to do. And I hope, and this is a bold statement, that family health teams, as this grows across this country, will adopt that as a go-to resource to help them help their patients. Thank you for joining me on this really important topic. It started with the Rick effect, which I wish we didn't have to go through. But the ripple of that is so positive, and I know this show, if you're watching, share it. If you're seeing this online, share it. And together, we're going to change the legacy of healthcare. Thanks for joining me.
Thanks, Marg.
Stay tuned, and remember, a healthy tomorrow begins with prevention today. We'll see you all next time.